Going live now. And you are live.
Good afternoon, everyone. This is a meeting of the Joint Rules Committee on Wednesday, January 12th. On our agenda today, we are continuing the discussion about how to come back into the building safely to do our work. And we have a policy to vote on, which is updating our mask policy. So again, really appreciate you taking the time to be here and to dive into this discussion. I had several conversations with members to get feedback on what you heard from the last testimony that we heard from Dr. Noyes, and thinking about what we heard from Dr. Leahy on what are some things to start, discussion points to start working through. We did reach out to Dr. Levine, and he was unable to come today. We asked if there was anyone else, and there was no one else who could come today. So we'll start with the ones that I think are more easier to talk through and go from there. So with that, I have an updated mask policy sent out that we'll talk about after we walk through these, but I just wanted to start with masks to see if we have consensus around us that we want to update the policy. So when we heard from both experts, we heard about the importance of mask and how a good mask and the different mask qualities. And one thing we don't have in our mask policy currently is really setting a threshold on what a quality mask is and the advice we heard. So I just wanted to start there with that topic. Is there consensus around the virtual table here that we should update the policy to include a certain level of mask quality?
Yes. I mean, yes. Yeah. And the CDC, I think I texted some of you the new CDC thing. They're upgrading to 95s, KN95s.
Yeah. Okay. Is there anyone who objects to updating the policy? Yep. Representative McCoy?
Do we have a draft policy? I mean, I don't want to say, yeah, let's do it unless I know what it is.
Yes. Yes. No, I did ask Betsy Ann to prepare a draft that you should have. Betsy, if you don't mind emailing it out to everyone, that would be great. And we'll look back to it. I just, before looking at it, just wanted to see if there was consensus to revisit it and update it. Okay. All right. I'm not seeing any further discussion on this point, knowing that we're going to loop back to this at the end. Yep. Representative McCoy.
You and I had spoken about writings on the mask, and I don't know if that would be a House rules issue or a State House issue.
That's right. We have in our House rules that you can't have any sort of signage or props on the floor, and that would definitely something on a mask would definitely count as that. Do you have the same policy on the Senate side?
I don't think we do. I'm going to defer to the Dean of the Senate, Senator Mazza.
No, I have not heard of any. I don't think it's ever been discussed. Hasn't been brought up. No.
And John Bloomer just popped on too.
Yeah, so generally speaking, the tradition of the Senate has been we're not allowed to wear really like badges or similar things. And so it probably applies to the masks. And so in that sense, it may not be a written rule, but the custom and tradition would include insignias on masks.
Yeah. Okay. So, so I'm looking to our parliamentarians here. Would it be beneficial then to have that explicit in our policy when we look at that draft?
It doesn't hurt, does it?
Yeah. Go ahead.
So I mean, from the Senate's perspective, to have it really apply, the Senate Rules Committee would have to do it. What we passed as a resolution allows the mask to be defined by our Senate Rules Committee. So it probably doesn't hurt. I'm not sure it applies to the senators, but the Senate Rules Committee has some discretion to be able to say that there are no insignias on the masks.
Okay. Yeah, go ahead, Betsy Ann.
And is this discussion in regard to just members, or is there discussion about it applying to staff or members of the public? I think there's a distinction between regulating members' masks versus other people's masks.
Oh, well,
Yeah, go ahead, Representative McCoy.
I'm not quite sure if staff is allowed to wear, I'm thinking campaign buttons or buttons on, is staff allowed to do that in the State House, within the walls of the State House? I don't know the answer to that. And I don't know if we could preclude the public from taking off I don't know.
I see, yeah, our clerk raising her hand. Go ahead, Betsy Ann.
First, I think the general expectation is staff should not be wearing any sort of, as far as political insignias, no, that's the expectation for everybody here. I do think there are, at least raises speech questions in regard to trying to regulate masks of members of the public. I think there's an expectation that everybody entering the State House would do so in a respectable manner. But I do think there's a distinction between regulating member masks, like the secretary indicated, the props issue. I agree with the secretary that although I don't think the House has props prohibition in rule, it is the custom to prohibit props during debate because members should be listening with their ears and speaking with their voice and ultimately their vote. So I think it could be a chamber expectation for their masks, at least House member masks, should not include any sort of political messaging.
Senator Clarkson?
So how do mask messages differ from political signs that we don't allow, I believe, in either chamber by the public holding? So, I mean, it strikes me they're very similar. So I think if it would be consistent to have the same policy as we have for people holding placards in the House chamber, which we don't allow.
Go ahead, John.
So the First Amendment right, I'm not an expert on this, but by not allowing them on the mask, it's like saying you can't wear buttons. And I think that if you suddenly started outlawing buttons, that would create an issue. The signs, placards are for safety and they're done by the rules. But with a mask, it's much more similar to having a advocacy day. I mean, then the question becomes, suddenly if you're from some advocacy group, they wear the little buttons, and I don't think you want to start outlawing those. I think that could create an issue. And so a mask is more like that than it is like a placard or a banner.
Go ahead, Representative McCoy.
So are you saying that we should keep silent on the mask policy? John Bloomer, Secretary Bloomer?
I think I agree with Betsy Ann. I know that. And so I think what she was saying is for the public, it's different. You have three categories. Yes. You have workers, you have the senators and representatives, and you have the public. The Senate and the House can regulate the individual members. I think the staff can be regulated, and there's an expectation that it be nonpartisan. And then for the public, you just want to tread lightly. I don't know that you would put any other restrictions on the masks and insignias that you wouldn't put on something that's on somebody's button. I mean, there are probably some types of buttons that would be inappropriate, and similarly, there may be some sort of insignias on the mask. But I think I would hesitate, or I'd recommend against doing it with the public.
So, am I hearing consensus on members?
Yes.
Yep. I'm looking around the room. Senator Brock, are you good?
I'm just thinking about the wording of it. It's clear that we don't want to have vote for Smith masks being worn by members. On the other hand, a number of our masks have insignia and indicia on it that describe what the mask is. For example, this is a mask that I typically wear, and in white on a third of the mask, it says KN95, product of, et cetera, et cetera. We clearly aren't trying to prohibit that. So it's just a
Right.
question of how we word things, because that
Okay.
is prominent and it can be read.
Yeah. I have faith that our incredible house clerk can come up with some language that we can thread this needle with. But it's a good point. Thank you. All right. Seeing general consensus, let's move on to another topic. And then we can come back and look at language in a little bit. Voting, how should I set this up? So the question of when we have members who have to quarantine for some reason, or have a family member who tested positive, or they took a rapid test and they're tested positive and they're waiting for their PCR. There was some discussion about letting members be remote in committees and allow them to be able to vote in committee. And so I wanted to come back to that discussion point about remote participation for members in committees. I think given where the numbers are, and we're talking about how we're going to come back safely, I think it's important to have that flexibility. Now open it up for discussion. Senator Clarkson's giving a thumbs up. Okay,
I just,
go ahead.
so, you know, that would be a difficult thing to police. I mean, we're never going to know. So it's based on the honor system for all of us that we're going to, you know, if a child is a close contact and the child has to quarantine for 5 days and can't bring, obviously, this the childcare will not take that child. So, I mean, there are specific instances, but I'm certainly not going to think that we're going to be calling up 20 members every day and asking, you know, like, or calling it, you know, like, so I'm fine with if it's laid out specifically that it's, you know, due to a COVID issue, regardless of whether it's yourself or a family member, you know. Yep.
Yep. I think, you know, we're using the honor system on the rapid testing. And so I think that would apply here too. Go ahead, Senator Clarkson.
We use the honor system on many things that the state has. Our per diems and everything else. So
Yeah.
in our expenses and stuff.
Yep. Were there any other hands? Oh, yeah. Representative Long, go ahead.
Thanks. I was just thinking about what Representative McCoy was just saying about COVID related, but I've got no problem with that. I'm just saying that I think we would want other illnesses also. We want, and we currently do encourage people to stay home if they're sick, right? So if they're sick with the flu, it would apply the same way, I would assume. So do we want to use the language of COVID specific? I'm just throwing it out there for a thought.
Yeah, I mean, I think it might be a little difficult during this time to try to distinguish between the two, because some people are just saying, I have it. Like, I'm assuming I have it and not getting a follow-up test and staying home, or they're having a hard time getting access to a test. And so they're playing it safe. So I think, yeah, we should be thoughtful with the language, but I agree, Representative Long. I think there's some nuance there to balance.
So,
Representative McCoy?
so historically, if someone had the flu, they would not be allowed to, they could always call in and listen, but they were never allowed to vote in committee. So if we are going to, you know, word this in a way that it is outside the parameters of COVID, then that is a historic change in how the chambers work, how the chambers have allowed members to work. And I mean, these things happened before my time, but I remember that, you know, members were wheeled in on wheelchairs to be able to vote in committee. And, so this is a paradigm shift in how chambers work. And I'm not quite sure if that's how this conversation wants to go, or do we want to, just center it around COVID issues at this point in time? Having in mind, as you said, that if somebody's, has symptoms that might be flu-like and they don't take a COVID test and they just think that I have the flu, I have COVID. I mean, I'm not going to certainly not, dial up and say, you need to take the COVID test because it has to be COVID related. And as we've said, it's on an honor system. I'm just not quite sure of how I would like the wording right now. If we're having this discussion via remote, not being face to face, maybe this discussion should have more eyes and ears on it to get the input of our chambers when we are fully back in session. I'm certainly agreeable to having the COVID related wording right now. But in the larger scheme, I think that we need a bigger discussion than what we have time for right now.
Yeah, and I'll just remind members that this is a conversation to see what we can find some consistencies on, so that we have some shared consistency in how we're reopening between the two chambers. So we're just looking for those consensus points here today. It will be up to the House and Senate Rules Committees to make their own decisions. So I'm just looking for broad consensus on the ability to be remote if you are sick or COVID related sickness. We can talk more about the details, but it's more about creating that shift because we haven't had that. Senator Ballant.
Thank you, Madam Speaker. Just to be clear and to make it abundantly transparent for everyone watching, we're having these conversations because we're in a pandemic. That's why we're having these conversations. We're trying to address the conditions on the ground. I don't think the speaker and I are interested in changing policy long term. That's going to be for that next legislature coming in next session, right? This is about this moment. How do we do our work now to the best of our ability, keeping people safe? And so if there are words that we need to, make sure are in any decisions that are being made by Senate rules or House rules, I encourage the members of those committees to do so. But I just want to make it clear, we're not trying to change any way that we do our work long-term. We're addressing the conditions that we have now, and we fully anticipate, however, that in future, next legislative session, there may be a hopefully, knock on wood, coming out of this pandemic, what have we learned and move from there? So thank you, Madam Speaker.
Thank you, Senator. Well said. Unfortunately, you froze for a brief moment, but I know. Well, we got your message. Thank you. Any other thoughts, feedback on this one? I'm hearing that there is consensus on moving forward, allowing this. And we just need to let the House and Senate Rules Committees come up with their verbiage for it.
Yep.
Okay, great. So the next one is around creating certain thresholds or pivot points for us to say, and to create some stability and understanding what would take us remote if we needed to go remote, and looking at the different metrics and thresholds. We've had a couple of ideas put on the table, given the conversations that we've had with Doctors Leahy and Noyes. So there's some of the ones are using the 7-day test positivity rate. Another one was around hospitalizations or ICU case numbers. And then another one is our own positivity rate within with members. So a certain percent are testing positive, that would create the pivot point to go remote because it's spreading within our chamber, and there would be a point where that would be not safe and we would need to go remote. So those are some of the ones that we heard, and I will open it up for discussion, maybe leading on the point of our own members and a percentage. Yep, Allison,
Oh,
no,
Jill,
Senator
Jill,
Clarkson.
it's okay. It's okay. I am Allison. I think the member discussion is only useful once we're all back working together. So I mean, that I don't think that's useful until we're back working together. So that I would table that one. But I think the 7-day positivity rate aligns very much with the CDC. So I think as much as possible, we want to be aligning with CDC. And I think at 8 or 10%, that would be absolutely aligned with the CDC. So I think that is, if we're trying to be scientific and we're trying to use measures everybody respects, that I think the 7-day positivity rate is a good one.
Senator, just to your point about the members testing. So how I would envision that is we get our rapid tests, we test Sunday, we test Monday, and we get a report in by 8 o'clock that X members have tested positive with the rapid test, which would, if it's under, we're meeting. If it's over, we're remote.
That's great, but it's a more complicated and requires a lot more back and forth. I think the 7-day positivity rate is one we have. We get it by Friday. We know what we're talking about. I think that the other involves a lot more back and forth. I mean, if you ask for our input, I mean, I would just say the 7-day positivity rate is a simpler one and aligns with the CDC.
Other thoughts, feedback? Representative McCoy?
So nobody else uses positivity rates. People just rely on what's happening in each individual school at a particular point in time. If a second grade class, 5 out of the 10 kids are testing positive, then that class goes remote for 5 days. The rest of the school continues on. So I'm envisioning this, we're treating our state house similar to what schools do, what businesses, businesses may be doing this, but nobody's basing on whether they come, they're pulling their workers out or not. And actually it's the opposite now in healthcare. They're saying what you aren't going to use in order to come back because of the healthcare shortage. They've shifted how they're doing it. So I think that we should be using our members' positivity rate. We've heard that geography from Dr. Noyes, geography doesn't matter. And so I think we should talk about the 4 walls of the State House and those members coming into that State House. How many of us, I don't know what that percentage is. That percentage may have to be different between the Senate and the House because there's less senators than there are representatives. So their percentage might be a smaller percentage, but I think that we should use the members' positivity rate. I don't know of any company that looks at the 7-day positivity rate and says, yep, we're shutting our doors.
Senator Ballant and then Senator Brock.
It's fine. Go to Senator Brock first. Thank you.
Yep.
I guess that one of my concerns is the absence of credible information that we have. One of the reasons that we stopped the last time And we said, we're going to get some medical testimony and we're going to get some public health testimony. And we're going to try to base what we do on testimony and objectives. I was frankly kind of disappointed in Dr. Noy's testimony in that I didn't think it gave me the complete background, and it gave me basically no background regarding public health to help guide us on making decisions. We can say that no company does this, but what evidence do we have other than anecdotal on which to base that? And I'm very concerned that we base a lot of what we do here and what we're talking about on anecdotal evidence or our best feeling. And that to me is not as adequate as I'd like it to be. Now, I guess my question then comes to where do we stand regarding public health testimony? And is it that Dr. Levine is unavailable, or is it that Dr. Levine is unwilling to be available, quite frankly?
Oh, I was not the one who spoke with his office. I'm sure that if we scheduled another meeting or another rules committee worked around his schedule, I can't speak for him, but I think they did send us back some other times for later in the week.
And I guess, whether it be Dr. Levine or any other public health expert, indeed from within or with outside the state, I'm just interested, how do people intelligently make these kinds of decisions based on facts rather than gut feelings?
Senator Ballant and then Representative McCoy.
So really appreciate the comment, Senator. One of the things that I know we've all been struggling with is trying to get a clear answer about what a particular lever would be that we can look at. And what we've noticed is that there really isn't agreement, and it's very difficult to get a public health expert to I think I'm frozen again. I froze again, didn't I? Yep.
Yep. We can hear you now, though.
Okay. We're having trouble finding a definitive answer. And so one thing that I would just remind the committee of is when the speaker and I did meet with Dr. Levine, and I believe there were other members of leadership on that meeting. This was a month and a half ago, maybe, in preparation for thinking about the session. And this is particularly directed to Representative McCoy. They were, Dr. Levine and his staff was emphatic that we are not like a school in many different ways. And so if you want to make an apples to apples comparison, it's really important to look at the factors that involve us. Now, I understand there is an emotional component and there is a compassion component. We all want to do the right thing by the people who work with us in the building, and we also want to do the right thing by the public. And I understand that you want to be doing what other places of employment are doing. I completely understand that desire. But it's difficult for me in a position of leadership to go all the way there with you when I've been told from Dr. Levine, you are not like other other places of employment for a lot of different reasons. And so we are not going to navigate this easily. There is really no good answer here. And I just want to say that publicly. And we have said, I've said on behalf of the Senate, we are a different chamber. We have 30 people. Our committees are small. I'm very concerned about our inability to do our work if we lose quorum in committee. So I understand too that we're coming together in joint rules, and we do have, different perspectives on this. And I just want to make sure that we're all clear that regardless of where we're coming from, we're trying to do the right thing. This isn't even so much about just House members and senators. We are an employer. We're trying to figure out what is the best place to land to be a good, conscientious employer for the people who also work in the building. This is not easy. And so I just want to encourage all of us to engage in this in a careful, deliberative way and understand that we're trying to figure this out in real time, and it's incredibly challenging. Thank you, Madam Speaker.
Thank you, Senator.
Good.
Other thoughts? Yep, Representative McCoy.
So to Senator Brock's comment, we stopped last time because there was a state of emergency by the governor, and we have not met for a year and a half. So that's the reason why we stopped. He lifted the emergency July 6th. We are fully back into the House August 6th. And committees have met, task force have met, committees have met throughout that time. So not using any positivity rates or anything throughout the state at any time for those last 8 months. We've never relied on that, ever. And, while schools may be different, and I'm not quite sure why a school is completely different than us, because those schools have been in session with students that up until a few months ago weren't even able to get the vaccination, and they were going in to school every single day. So, I would argue still that I'm comfortable with using the member positivity rate, just like schools do, just like offices do, just like any business would do. They do not base anything on the positivity rate. It is strictly based on what's happening in their area, their employer area. So.
All right. So I see Senator Mazza and then Senator Clarkson.
Yeah, just to err on the side of caution, I don't know, this is a serious issue nationwide. If you listen to the results every night across the country, and we're going to be that way for the next few weeks. And I don't think we're neglecting the public by being remote. I don't know what the issue is, because in fact, I've had more people be able to testify in my committee the last week than ever before, because they're free to testify. If you've got 8 or 10, they're waiting in a waiting room, it's fine. So, I don't think reports tell you one thing, but on the other side, if you look at what's happening nationally, why do we want to put ourselves in that situation? Thank you.
Mm-hmm. Senator Clarkson.
Thanks. I got so engrossed in what Dick was saying, I totally forgot what I was about to say, but I will think of it and I will return to it in a moment.
Sounds good. All right. So I know that we have a hard stop at 1 o'clock and we need to do the mask policy. So I think, I see Senator Clarkson. Did you remember? Okay, go ahead.
Well, I remembered, and I'd just like to read us something. Because I think we are different, and I think employers are doing different things. And I think, having looked, I took on VLS and Dartmouth and UVM, and they take all the data, Patty, and they make their own decisions. I mean, so they're all using all those inputs, all the data, and they're all making their own different decisions. And it ends up being a fairly institutional based, their values applied to that data, and they make the decision. I'd love to read something from an editorial that was last week in the Valley News, if I may, Madam Chair. But I also want to offer that if we need to hear from somebody outside the state, somebody from the Harvard School of Public Health, I mean, we have resources available to us that we could get. I would just love to know more, and maybe I just haven't listened closely enough to what other state legislators are doing to decide to either return or not. And I would say the one difference is we're still Omicron is still climbing in this state. If we were to look at when it plateaus, that's great, but we've been told it's going to be another at least 3 weeks until we hit the peak of Omicron. So to come back in the middle of a raging variant seems just a not a wise or responsible choice for us as employers and as people looking out for the people that are going to be in this building. But if I may, Madam Chair, I'd just like to read from the World Health Organization. May I?
Yeah, you may.
So this was in the Valley News last week, and it was an article about what we're talking about. And Mike Ryan, the physician who's the head of the Health Emergencies Program at the World Health Organization, was recently asked by the Health News site Stat about lessons of the last couple of years. And he says, there's been tremendous social, economic, and political pressure to go back to normal. He added, time and time again, governments have tried to get back to normal and have overshot that runway by opening up too early.
Good.
All right. So here's what I want to do next then. I think there needs to be more conversations between the House and the Senate Rules Committee and how we move forward with certain thresholds. I think, you know, we have a House Rules meeting later today, so we can pick up that conversation. And I think in the meantime, we should just have the leadership being in touch with one another about what they're hearing and decision points they want to make. It is our jurisdiction and it is our decision on the mask policy. And so I want to make sure that we do get that done today. So we will continue the threshold conversation amongst leadership and in our House Rules and Senate Rules Committee meetings. And let's take a look at the draft policy on masks. If the clerk will please, do you mind doing a share screen and walking us through? That would
Sure
be great.
thing. Thank you. One moment, please, while I pull this up for share screen. And can you see it okay? Great. Okay. This is a draft revised policy with changes to your current legislative face mask policy with the potential revisions in your standard strike through and underlining as you would in legislation. This high level overview, what this draft would do, it would change the permissible types of masks that could be worn in the State House. It would also change the language on accommodations for medical or religious exemptions from mask wearing. And it would also change language on when facial coverings, AKA masks, can be removed. And it also changes the length of time that this mask policy would be in place. Part of these changes are based on the language of the Joint Legislative Management Committee reviewed as potential revisions to the staff employee, the staff face mask policy, which in turn was based on the pending federal ETS, which does have conditions on mask use in employment areas. So as far as the types of masks that could be worn, big picture, this starts out at the beginning of the draft, and it would prohibit cloth masks, and it would address the specific types of masks that are acceptable. So starting out with this language, this potential revision would say that a mask shall, one, completely cover the individual's nose and mouth. That's existing language. But two, it would need to be a medical procedure or surgical mask, or be similarly made of multiple layers of non-woven polypropylene material. What that means, it's the blue masks that we're used to seeing. Those blue, they're called sometimes the surgical or procedural masks. It's what our Sergeant at Arms office gives out to members of the public. Those standard paper-looking blue masks. It could also be an N95, KN95, or KF94, or similar grade mask, or a more protective grade mask. It would need to be secured to the head with ties, ear loops, or elastic bands that go behind the individual's head. That's coming from the federal ETS, and fit snugly over the nose, mouth, and chin with no large gaps at the sides of the face. It goes on to say that facial coverings made of cloth and facial coverings that have any slits, exhalation valves, visible holes, or punctures are prohibited. And here's the language about member masks needing to conform to the chamber's custom of prohibiting props in debate. So big picture, but just the standard cotton masks, for example, the gaiters would be prohibited. It would at least need to be one of those surgical procedural masks or higher grade and fit snugly. Madam Speaker, I'll just keep moving on unless you want to jump in and stop me or anybody else does.
Why don't we keep on going, and then we can, after you do the walkthrough, we can open it up for questions, clarifications, and discussion.
Sounds good. Thank you. So this language goes on to say about people who discuss people who are not in compliance with the mask requirements. The existing language says that individuals who do not comply will be asked to leave and may be escorted from the legislative space. That essentially is in regard to members of the public, for example, but when it gets to members, the existing language provides that the Sergeant at Arms or Capitol Police is authorized to escort a member of a committee, and the potential language is to say escorted upon a chair's request. For example, since with the acknowledgement that the chair has general supervision over a committee room. And then there's the existing language that's in there that a chair may choose not to recognize a member of the committee until the member's in compliance. So that's your existing language. Then your existing policy does allow for medical and religious exemptions. And here's just some cleanup language about people requesting that the Sergeant at Arms requesting to the Sergeant at Arms that they be granted an exemption. So just some technical cleanup language on the need for a medical exemption. But what was provided in your current policy is that individuals who are granted a medical or religious exemption would need to provide proof of a negative COVID test taken within 72 hours. That's what the current policy provides. So that could have been a PCR, results of a PCR test taken within the last 72 hours, but this new language would substitute the requirement that instead of a negative PCR test, for example, that individual granted a medical or religious exemption would need to provide proof of a negative COVID rapid test provided by the Office of Sergeant at Arms in order as a condition of entry to the State House. That language is substituted there. The type of test is an acknowledgement of the understanding of the Omicron variant's high transmissibility rates, and a PCR test taken within the last 72 hours might not show a person who has since become infected with COVID. So a rapid test would be substituted there, and those would be the rapid tests that the Sergeant at Arms office would provide. And maintaining the existing language that if a person cannot provide proof of that negative COVID test, that they would need to participate in the proceedings remotely, except when prohibited by rule. Then the policy gets into the language about when masks can be removed. Here, just adding in that they can be removed while eating or drinking in the cafeteria. Here's potential with the understanding that the cafeteria might be, or is probably one of our biggest concerns in the State House. Here is language potentially saying that facial coverings could be removed while eating or drinking in a member's designated committee room. With understanding, again, this is up to each chamber to implement, and also with the understanding that chairs have the general supervision over their committees, or in a private office. And the current language of your policy says that an individual could remove their mask even when they're not eating or drinking, but they can remove their mask when they're alone or with other members of their department in a non-public area of the State House, if everybody agrees that they're comfortable with everybody removing their facial covering. But as I understand it from speaking with our legislative counselor who is closely monitoring the ETS, that's not permissible under the ETS, for example, for staff members to agree all together that they will all remove their masks together. That would not be permissible. And so with the idea that this policy was created to have a universal policy that would apply to everyone, this language would say instead that a person could remove their mask when they are alone in a room with a closed door in a legislative space. And that language at the end, that they're alone in a room with a closed door in a legislative space, is also taken based on the federal ETS, which I understand it provides that an employee can only remove their mask if they are alone in a room, and it's actually an enclosed room with a closed door. And then finally, the language currently provides in your policy that the mask policy would terminate when all counties in Vermont are identified as being in a location with a low or moderate transmission risk as defined by the CDC, and with the understanding that the federal ETS that would not comply with the federal ETS requirements that are pending. This language would just say that the policy takes effect 24 hours after approval by this committee and remains in effect until otherwise provided by this committee. Again, with the understanding that this was the recommendation to the chambers and to JLMC for staff, but it would apply if approved by this committee with these changes for members of the public. Madam Speaker, would you like me to do stop share? I think all members have this now. And I can
Yep,
wait.
that would be great. Thank you. All right, so I will open it up for any questions, clarifications on the policy. Questions for the clerk? Representative McCoy.
Yeah, I just have, can you just go over that last paragraph, please, Betsy Ann, and explain why we're not going to follow the CDC guidelines as to lower moderate transmission risk? Is that, I didn't quite understand what you said there.
Thanks. One moment. Let me just pull up my notes on this issue.
Okay.
Because I did get some feedback on this. All right. Okay, so thank you. That language that would say that the mask policy remains in effect until otherwise approved by Joint Rules Committee is an acknowledgement that if the federal ETS takes effect, the mask policy would still need to be in effect for staff, even if transmission levels in Vermont dropped. So it was an attempt to have a universal mask policy that applied to everybody in the State House, including staff, who would still be required to comply with the federal ETS, even if Vermont counties dropped to low or moderate transmission of risk.
Okay.
Any other questions? Any further discussion? I would open it up for a motion to adopt I don't have the draft number.
Sorry, I don't think I have, we can call it 1.1.
1.1, thank you. Senator Clarkson.
Happy to move that we adopt joint rules draft 1.1 on our updated masking policy.
Thank you. Is there any further discussion? Seeing none, I will call the roll. Senator Ballant.
Yes.
Senator Mazza. Oh, you're muted, Senator.
Yes.
Thank you. Senator Clarkson.
Yes.
Senator Brock.
Yes.
Representative Long.
Yes.
Representative McCarthy.
Yes.
Representative McCoy.
Yes.
And I am a yes, so the motion carries 8-0. All right, so with that, everyone, that wraps up our agenda for today. I will open it up for any questions or thoughts on further agenda items or meetings. Senator Ballant.
Yes, thank you, Madam Speaker. I just wanted to share with you the way that I've been thinking about these issues, because this is difficult to navigate. There's a lot of different parts here. And one thing that I just keep coming back to, because now this is the third session when we have had to do some version of remote working, right? So we got halfway through our session in 2020, and then the question that we keep coming back to is how best can we do our work? We have a lot on our plate to get money out the door to help Vermonters. We have a lot on our plate, investments in housing, policy that's really going to positively impact Vermonters. So for me, I just keep coming back to how best can we do our work? How do we make those decisions to best facilitate our work? And so I don't have, a place where we all should land right now, but I feel like if we put that at the center of these conversations going forward, we're going to be able to figure this out.
I know that we're all going to work together to figure this out. We always do. And I appreciate everyone's hard work and coming together, asking really thoughtful, good questions to our witnesses, to our health experts, and continuing to do further research with the CDC and other venues to get that information. Our goal is to make sure that we can find a path to reopen the building in a safe and cautious way. And so we will continue these conversations. And like I said, I believe House Rules is meeting this afternoon to pick up this conversation. And we will keep in contact and keep this discussion going with Joint Rules as well if needed. So with that, are there any other flags or agenda items that we should put on out for a future meeting? Or are we good right now? Okay. All right. We will, I will be in touch, and I appreciate your time today, and we'll get this mask policy out. Thank you so much, everyone. Our meeting is adjourned.